Now, after that commercial break, we transition into an interview talking about Mass Design Group, which is a U.S. architectural non-profit firm that extended their arm here in Rwanda to bridge the gap of professional architects, but also contribute to socio-economic development through community-based and infrastructure projects here in the country. They've worked on projects like the University for Global Health Equity. They've worked on Ruhe Primary School projects. They've worked on the Ellen DeGeneres campus for the Diana Fossey Gorilla Fund that is still in the progress. They have different other projects like the ALU and the University of Rwanda projects that are still in the pipeline. Now, right now, I'm joined by Benimana, who is the Managing Director of Mass Design Rwanda, and we're basically going to have a conversation more on how Mass Design came about. So you're very welcome to the studios of Rwanda Broadcasting Agency.
Thank you for having me.
It's a pleasure. Now, you've already worked on big projects here in Rwanda, and you still have more that are still in the pipeline. And, you know, from Boston to Kigali, how did that process come about? You know, we know Mass Group is basically, you know, established in Massachusetts, Boston, but, you know, you came to Kigali. Why Kigali, and how did you come to Kigali?
Yeah, that's an interesting question, James.
Right.
MAS actually stands for a model of architecture serving society.
Right.
Contrary to popular belief, has nothing to do with Massachusetts.
Right.
But it is true that it was born as an idea out of graduates who were at Harvard at that time, who remain our co-founders at the moment. But at the time, you know, there was this kind of like question about what architecture does and who does it serve. Mm-hmm. And I think in exploring that question, there was an opportunity that presented itself and happened to present itself in Rwanda. And that opportunity is the Butaro Hospital,
right,
which is probably one of our most famous project, which was at Rwanda Ministry of Health and Partners in Health,
right,
an organization that fights for global health care delivery for most of the poorest people in the world.
Right.
So I guess that's probably where the first demonstration of what this new form of practice for architecture in the built environment came from. And that opportunity in Rwanda, of course, was leveraged to the fullest to give birth to the Mass Design Group that we see today.
Basically, you worked so hard in simple words that Mass was like, you know what, let's have Mass Group out there in the country, and, you know, let's see what they can do, more or less.
Yeah, well, actually, the Kigali office is our first and remains our largest office
in Africa,
in the world.
In the world.
In the world.
Wow.
Everywhere where Mass Design Group
right,
works. So Rwanda has become this unique ecosystem for us to be able to prove that this new, different model of practicing architecture and design can actually work and can best serve in situations such as countries in Rwanda, where our transformation journey is actually pushing to seek for local solutions, mm-hmm, but that can produce results,
right,
that makes the society move forward.
Now, looking at the projects that you've just mentioned, talking about Butaro, and you can also talk about the University of Global Health Equity, there's definitely other projects you've worked on. What is the theme or the model or the approach when you are working on different infrastructure projects, especially you, Mass Design being a nonprofit? Like, what's usually the approach, and also maybe you can line up a few projects you've done here?
Yes, maybe before I speak about the approach, I need to talk about a little bit about the philosophy, because
right,
that's very important.
Right. So
we are founded on the mantra that architecture and design are never neutral, that through our actions we deploy as architects and designers, we're either going to hurt or we're going to help.
Right.
And we seek to figure out both a structure that allows us to operate in a way, mm-hmm, that we can help, and then also figure out how each project is deployed to help instead of hurting. So I want to address the question of the not-for-profit, because sometimes it gets confused when people hear that we are not-for-profit. They assume that we work for free. We don't. Mm-hmm. We do need to cover our basic costs. We employ professionals who needs to form a career out of this work, because we do not believe that architecture and design should actually be done by volunteer labor.
Right, right.
That does not benefit from that because it's such an important work. That's the first one. So that has to do with our structure as a not-for-profit. We are not owned. We don't have shareholders. We answer to a board, and we stay true to our mission, and our board keeps us
in line with
our mission.
Yeah, with the mission vision.
Now,
right.
speaking about the projects, the process varies from partner to partner, from location to location, from context to context. But each project, we have the same approach. We need to figure out how, through the partner's mission, our project is going to become a platform which enhances their mission and make them work better and achieve their mission better.
Right.
So that's the same approach we did for Butaro Hospital. The project was thought at a time where Rwanda was still wrestling with.
Let me ask you a tricky question.
Sure.
What if a partner comes in and they have a project they want an infrastructure project, but somehow does not feel like it aligns with your vision and mission? Do you turn them down?
No, we work as a proxy. So our projects, our mission aligns with most of our partners' projects, and their mission, our mission has to align with theirs,
right.
So that we can help and serve them better.
Right.
I can give a very quick example. If we're working with a partner who's in the education sector, then our mission is not to build classrooms, is to get better education outcomes.
Right,
and the medium to which we can help is built environment and infrastructure.
That's quite interesting. Now, take us through some of the projects you've done here.
Well, just now I was talking about Butaro Hospital. So
right.
basically looking at this legacy of healthcare delivery in rural Africa. And when you don't have to do much reading to see that it was and still plagued with a lot of fatalities that are necessary in the 21st century. And some of these are lessons that people have been studying for centuries that have been solved. So you wonder why, in Africa we continue to have such poorly built infrastructure that lacks even the minimum basics that allows for infection control and these things. So those are the kind of like questions that we have to go through and also figure out how this infrastructure can serve better the country's ambitions in healthcare delivery. In addition to that, figure out how through this economic transformation that the country is trying to push forward, we can innovate in materials and work with the local available skills and teachable skills with local people to build these facilities, because we don't believe that we should rely on Chinese and Turkish contractors to build everything.
It's basically building Africa for Africans using African materials.
Exactly.
Right, and also I think you've hired basically Rwandan designers, which is also part of creating employment for local designers, architecture designers as part of your whole mission. Now, as we conclude, allow me to at least share with us what are your future plans in the country when it comes to infrastructure projects that you keep running.
Well, our future plans really are hinged and depend on the success of the projects we've had in the past, and we've had enough pool of projects that allows us to think that this platform that Rwanda as a country has allowed us to benefit and enjoy, where we think that we could really take this model across the continent.
Right.
The economic so the country's transformation of Rwanda has provided us an opportunity to innovate, to test, and to scale the project sizes we've done, the typologies, and everything. And now we are at a point where we believe that we have actually proven the feasibility of this across a large spectrum.
Right.
And we believe that with Africa's population growth, which literally translates to enormous infrastructure needs in the next 20 to 30 years, as you might know from these statistics, these solutions that we've been able to develop in the country, in Rwanda, can become a model for equitable
for Africa
development
in general, right?
Of Africa.
Right. Thank you so much, Christian, for for the insight into what Mass Design is doing here in Rwanda, and we wish you all the best in all your endeavors. So
my absolute pleasure.
It was a pleasure. Yeah.